Hello once again, welcome to Herd Immunity News. I'm Marcus Botzer. It gives me great pleasure to welcome on the show today Dr Anthony Hinton. Many of you would have seen this great man appearing 2020 on platforms such as Talk Radio and GB News, even on the mainstream channels. He's been there. He is a ear, nose and throat surgeon. He's been qualified and practicing for over 30 years. He is a gentleman of amazing repute, and he has come into quite a storm, if you like, because he's someone who actually will tell you exactly as it is without fear or favour. But without further ado, Dr Hinton, how are you today, sir?
I'm very well, thank you, and thank you very much for inviting me on.
It's a pleasure. On your medical background, is there anything that you would like to add in for our viewers and listeners that would be helpful?
Well, I've worked in the NHS for over 30 years. I've retired from the NHS recently. In fact, just before the COVID debacle, the COVID pandemic, panicdemic, however you want to term it, really. And actually, I found that whole period quite disturbing. What went on with both medicine and science, the usual sort of medical and science questioning seemed to just go out of the window during that time.
Indeed. I mean, our first question, our first point to you is, how soon did you realise that the Johnson regime, Sage, Imperial College London, how soon did you realise that they had done absolutely no cost-benefit analysis and that the cure would actually be worse than the disease?
Well, actually, if you remember, the first lockdown, I think, started 23rd of March, 2020. I mean, 2020, blimey, that's a long time ago. And I remember saying to my wife by the second week in April, this is all just ridiculous. This is totally unnecessary. Because remember, every evening they'd got on the TV, all these figures that they were showing of people that were infected, people that were dying. And by the second week in April, the number of deaths was starting to reduce. So if you then worked back when those people got ill enough to go to ITU, how long it took them to get ill enough in hospital to end up in ITU, how long it took them to get symptoms to go to hospital, and how long before that they were infected, we come to the conclusion that the infection rate was starting to drop before any form of lockdown. So the lockdown was completely unnecessary. So even if you thought the lockdown was not going to do any harm, which of course it obviously did, it was not going to do any good. It wasn't necessary. As with any virus, it comes through in waves, just like we get in the winter with flus and colds, and lots of colds, of course, are coronaviruses. It's just a sort of natural progression. So from that point onwards, I was against that and started speaking out against, as it were, then the lockdowns and the harms that lockdowns were going to do in children's education, in cancer, in misdiagnoses, for lots of other things. And you can see all the trouble we've got from that, where we are today.
Indeed. And if we can just touch on the testing, on the PCR testing itself. Now, the creator of this testing, the late, great Carrie Mullis, came out and said quite publicly, 2019, I believe it was, that mass testing for corona SARS viruses was not the purpose of this PCR test, but they relied upon this despite the creator saying it's not suitable for purpose. What were your thoughts on that?
Well, I mean, he also said that if you run the cycle thresholds long enough, you will find anything in anybody because it is just so oversensitive. So partly, I would agree. I don't think it was a test that was designed for that anyway. But even then, the way they ran the test was incorrect. And they must have known it was incorrect because it was quite clear that if you ran the cycle threshold, so each cycle threshold is sort of more or less doubling up the amount of stuff that you'll find in your sample. And if you run it for about 20 times and you find it's positive, that may well be a patient that is infectious. But they were running cycle thresholds up to 30 times, 40 times. So lots of those tests were just finding people with old bits of dead RNA virus that perhaps not even from that sort of coronavirus that they were looking for. It was completely unreliable. And they were just ramping up this sort of test, not realizing that, you know, just a positive test is not a case. That's not an infected patient. Totally different. I mean, actually, if they'd never had the test and they'd never had lockdowns, and we just treated people symptomatically as though they had a normal respiratory flu-like illness, the results would have been loads better. And I think lots of doctors looking back at that now will know themselves that that is correct. But I think lots of people don't want to accept it because it's too upsetting to believe.
Well, you were one of the first voices that came out in a whole plethora of good people who backed and supported the lockdowns have come out at the back of you, if you don't mind me saying. But when we look at, I think people were touching on exosomes, the exosomes that were these particles that were traces that couldn't be relied upon. You were putting this forward, but what was the response from the NHS or from the government when you raised these concerns?
Well, from the government, well, I suppose I did have a bit of a response from the government in that in I think 2021, I found out that I was being spied on by the government misinformation unit. And actually I said to colleagues, I don't really care if they're spying on me or not. I'd like them to actually take some notice. And the problem is they took no notice. They just shut us down. So at one point I was thrown off Twitter for posting something that I thought was perfectly reasonable. I was actually on holiday and I'd had a sauna and there was a sign outside the sauna that said people who had heart problems or ladies that were pregnant should not use the sauna because of the risk. And I just thought, blimey, there were so many things we tell women not to do when they're pregnant. You know, unpasteurized cheese, alcohol, saunas. So I took a picture of this sign, I posted it on Twitter, and I said, isn't it amazing? All these things we tell pregnant ladies not to do, and yet it's okay to take a new genetic modification injection. And the next day, I was gone. Yeah. That was me finished on Twitter until Elon Musk took over and gradually a few of us came back on again. And then later on, I still work at 2 independent hospitals and I was called in to see the medical director and the chief executive of both of those 2 independent hospitals. And they said they'd had complaints about me. And I said, what complaints about? Oh, about things that I'd put on Twitter. So I said, well, can I see the complaints? No, you can't see the complaints. I said, well, are these complaints from my patients? No, they're not from your patients. And funny enough, actually, I get a lot of patients come to see me now because of what I've said. Not people. I mean, I suppose there may be some that don't come because of what I've said, but I still wouldn't see them. So they said, no, you can't see them. I said, well, what are they saying that I've said is wrong? No, they haven't said there's anything you've said is wrong. They just think it's wrong that you're able to say things. And I said, well, I've got a right to free speech, haven't I? Which they had to agree with. And then both of these independent hospitals separately said to me, they both used exactly the same phrase. They said, as a medical business, we have to be seen to support the government line. And it's only afterwards I thought of that and I thought, why did they both use that exact phrase? because someone from the government had spoke to them. That's why they both used the exact phrase. And it's not long after that, there was an inquiry by Big Brother. They did a big freedom of information thing, and they got a whole load of information from the government. And just about 2 or 3 weeks before that incident at those hospitals, I was being discussed in some sort of government committee about my tweets about lockdowns. And they got all sorts of data about how many people had seen it, how many people had retweeted it, how many people had then seen the retweet. And I thought, well, why didn't they get some of us in and talk to us about it? One of the good things that's come out, I mean, there's very little that's come out of these COVID inquiries. I have to say there's more has come out of the Scottish COVID inquiry than the UK one. And one of the things that did come out of the UK one was the suggestion that they should in future have so-called red teams of doctors and scientists taking an opposite view to the official advisors to sort of test out what they're saying. And perhaps if they'd have done that this time, we wouldn't be in the mess that we're in now. A few people did get to speak to Boris. Professor Carl Hennigan, Professor Sunita Gupta had, I think, some sort of Zoom meeting with them quite early on, but their views were basically just poo-pooed and swept under the carpet.
Yeah, I mean, great people like yourself, Dr. Claire Craig, Dr. Mike Yeadon over in America, Robert Malone, Dr. Robert Malone, fantastic information that was available on social media, but it wasn't available on the mainstream media.
No.
As it transpires, when the Matt Hancock diaries came out, remember him?
Yeah.
Who broke the rules and the laws himself, as did Professor Neil Ferguson, and later on we come to Partygate. A lot of people are asking themselves, those that had the information to the veracity of this virus and its deadliness behaved like it was nothing more than the common cold. Is that a fair conclusion that these people are coming to?
Because that's more or less what it was. It was something somewhere between a common cold and influenza. Probably not as bad as influenza. It turned out worse for some patients because of the way they were treated. Not because, I mean, let's have a look at care homes. I mean, care homes, all these people locked away in care homes. Now, I discuss these views with any patients that bring it up with me. And a patient the other day, in fact, quite often they'll say, but the lockdown, it did protect all those people in care homes, didn't it? I said, no. Lots of people died in care homes, not because of COVID. I said, let's just do a little thought experiment. Let's assume that tomorrow the government announces that there's something bad about, they don't really know what it is, and they suddenly lock down all the elderly people in care homes. They're all stuck in their own room. They get no visitors externally, no doctors going to visit them. If they get ill, they can't get sent to hospital. No one can adjust their medication. And if they get a little bit more ill, they start to give them medicines to supposedly make their passing more comfortable, like morphine and midazolam, that if you have a respiratory illness where you're already struggling with your breathing, it just makes that problem worse. And I say to them, how many patients do you think, how many of those people in care homes would then die in the next 2 weeks? I said, it'd be thousands again. So that's what killed lots and lots of people in care homes, not because they caught some virus that was much worse than a normal flu year. It was mismanagement that did that. And in a lot of cases, sort of inhumanity and cruelty to not allow people to see their relatives. I mean, there were sort of people who were not allowed to see their dying relative in hospital. Well, what was going to happen to the dying relative if they just allowed some people to go in and visit them? I mean, they were dying. It was just crackers.
And the COVID inquiry isn't interested in this through the terms of reference, which have been stated by KC Hugo Keith. Not interested in anything. And it was the plethora of DNR certificates that were given to people throughout the United Kingdom, especially here in Scotland, as a default position. Subsequently, people that have got in touch with us, Dr. Hinton, have said they weren't allowed to see their loved ones. They were
Yep.
kept in exactly the conditions that you described, and they were put onto ventilators. And if you
Yep.
look on the NHS website and you look at the survival rate, the mortality rate, if you're over 80 years old, it's something like 4%. It was almost like a death sentence.
No, ventilators will wreck your lungs. I mean, ventilators are one thing for a short period during a general anaesthetic for an operation, say, or even for maybe 24, 48 hours as you recover from maybe major brain surgery. But if you've got a patient that is on a ventilator for weeks and weeks, and that, because that they talk about how many people have been very ill after getting COVID in hospital. And of course, there are a few people that got very, very ill from COVID. There are far more people that got very, very ill because they were on a ventilator for weeks. And on some of those patients, there may have been absolutely no choice but to eventually put them on a ventilator. But of course, there are also medications that we know were completely ignored. So, very early on, there was talk about things such as ivermectin, an antibiotic called azithromycin, hydroxychloroquine. And if we go back to the beginning, of course, any of those things that were mentioned by a particular president of the United States at the time were totally poo-pooed because it was him that mentioned it.
Indeed.
And the same, if you remember way back when the vaccine was first being put forward, it was the sort of Trump vaccine, and all the Democrats were against taking this Trump vaccine. And then as soon as the election happened, then it was the Biden vaccine, and they were all for giving the vaccine. And of course, the vaccines have proved to be not only ineffective, but extremely dangerous. And in fact, the more you think about that mRNA technology, the more you realize it's just totally nuts. The whole thing should be banned. I mean, you're talking about giving an injection of something that in your body is then going to produce the vaccine. You're not injecting someone with a vaccine. You're injecting them with some genetic material that may make a small amount of vaccine, a large amount of vaccine. It may not make the correct proteins. It may be contaminated with DNA. We can see the problem it's brought about. It'd be a bit like having paracetamol in your local pharmacy and you go in to buy some paracetamol for a headache, and you just buy a random box of paracetamol that may have a tiny, tiny dose that won't affect your headache or make you feel any better at all. It may have the correct dose, just right, or it may have a massive overdose that is going to completely rot your liver and kill you. The whole idea is just crazy. And of course, they're trying to roll that out for all sorts of other things, for RSV, for bird flu vaccines. They want to make the influenza vaccine mRNA. And of course, the recent new booster that's come out is a combination of the original Wuhan strain of virus, a bit of an Omicron strain of virus, both of which aren't in circulation anymore anyway. And then that booster, they say, oh, it's more or less the same as the previous one. So it doesn't need any testing, doesn't need any trials or anything. But, oh, you need to have it because it's new and it's updated. Well, it can't be both. If it's new and updated, it should go through a trial. But increasingly, fewer and fewer people are taking it. I think last year, NHS staff, 70% didn't take it.
Indeed. I mean, the point was made in defense of the vaccines of surgeons who have to have the hepatitis B vaccine. But am I correct in saying that they actually have serological tests done beforehand to see if they've actually got antibodies in the first place?
Yeah. I've had the hepatitis B vaccine as a surgeon, and that is to protect me from catching hepatitis B from a patient, and to protect then patients from catching hepatitis B from me, because I'm doing what's called exposure prone procedures. In other words, I'm exposed to patient's blood. And if I prick my finger with a needle during an operation, then the patient is exposed to my blood. In fact, the surgeon is much more at risk than the patient than the other way around. So I first had a blood test to check I didn't already have antibodies to hepatitis B, which I didn't. So I therefore had hepatitis B vaccine. Then a few months later, you have another blood test to see how well that vaccine has worked. And if your antibody levels are high enough, you never have to have another hepatitis B vaccine. But even the hepatitis B vaccine thing is interesting as well, because in the United States now, and I think more recently in the UK, they've started giving the hepatitis B vaccine to newborn children, which is nuts. Now, the hepatitis B vaccine is for people who are at risk. So apart from surgeons, it would be IV intravenous drug users, or it's a sexually transmitted disease. Well, how is that relevant to a newborn baby? Unless the baby has been born and has parents who are known IV drug abusers, which will be a tiny, tiny fraction of people. But it's been used because, of course, the pharmaceutical companies want to get these things on the list of children's vaccines. Particularly in the United States, that is extremely important, because in the United States, as soon as a company has got a vaccine on the children's list, that company is completely immune from any problems with that vaccine, even when given to adults. So, I mean, if the drug companies are confident of their product, why do they need immunity?
That's a very good question. And the vaccines, of course, we had no long-term data on the information. The tests that were carried out were very redacted. The information to it was similarly redacted. And as it turns out, the great work has been done over in Australia by Queensland Senator Dr Gerard Rennick, who was one of the first people through a Freedom of Information request to get hold of some of the absolutely alarming data from the Pfizer. Subsequently, Andrew Bridgen has done the same thing here. I'm sure you know of Andrew's work. We've had him on the channel. And he's presented facts and information which suggest that they knew that the vaccines of the Pfizer in particular would neither stop transmission nor infection for a population that it was a high risk to 0.01%. I mean, this is insanity.
Well, you see, that makes me extremely annoyed. I don't know whether you know this, you may be shocked, but I took 2 doses of the Pfizer vaccine, as did my son, who's also a doctor.
Yes.
And we talked about it for hours and hours and hours. And in fact, there used to be jokes in the coffee room. Who was going to be the first person to come into work with an extra head growing on their shoulder? So it was known that these things were weird stuff that had never been done before, that it was genetic. We knew all that. And yet we took it. So why did we take it? Because we were being pressured that in order to protect our vulnerable patients, if we took the vaccine, we couldn't catch it, and therefore we couldn't transmit it to our vulnerable patients. And myself and my son sat there and we said, well, you know, doctors have had to do loads of things in the past because, you know, for the patient's benefit, even though it's a risk to them, and, you know, it's part of the job. So we took it. And I'll tell you, within 2 months, I knew colleagues that had taken 2 doses that were catching COVID. And I thought, well, it doesn't stop you catching it. It doesn't stop you transmitting it. We were lied to. And they absolutely must have known that. Well, I'm not saying, perhaps not say they must have known that. They had no data to prove that you couldn't catch it or pass it on, which I guess is slightly different. But they had no proof that that was true. And in fact, when you look back, it's difficult to find anywhere where Pfizer actually claimed that. It was sort of politicians that were sort of claiming that. On what basis? Well, on no basis.
Well, patients were presenting with apophylaxis straight after these initial vaccines that were rolled out in December 2021. But there was no concern in the media whatsoever. They went for this one-size-fits-all remedy.
Yep.
Whereas even an experienced GP in their first year in practice would say that every single patient is different, surely to goodness.
Well, when I had my second dose, there was somebody that I know that had a second dose on the same morning, medically qualified. And they had and basically my, I don't know whether you took it or not, and that's up to you.
No,
but
no.
My consent was, had I got any allergies and which arm did I want it in? That was my informed consent. So this other person that I know very well, they had their second dose and they were leaving the place where they had the second dose. They only waited around about 5 minutes or so. And they'd gone down a few floors in the elevator. And by the time they got to the bottom, this person, their lips were tingling.
Yeah.
They were feeling a bit short of breath. Luckily, because they were medically qualified, they realized what was happening and they went straight back to the vaccination center. They had to have an IV drip, steroids, adrenaline, were in hospital for a couple of days. And this person said to me, if it had just been another 5 minutes later, they would have been in their car on their own, driving home. They would have been just put down as a death in a road traffic accident. So that person was extremely lucky. And then they were then trying to force that person to have a booster. And I had to write letters and fight for that person to be exempt. And the only person that could make them exempt was their GP on the GP's sort of registration system. And there was pressure being put on GPs not to allow people to register as exempt for medical reasons. And eventually, the only way the GP was willing to do it was for me to write a letter indemnifying them and saying I had instructed them to do it. I said, yeah, that's fine. I'm quite happy to do that. So that's what I did. And they didn't have to take any further. And that way they were still able to get this vaccine passport and all the rest of it, even though they hadn't sort of had all the required doses. But the whole thing was just crackers. I mean, there was no sort of medical ethics involved. I mean, that is not normal medical ethics. I mean, when have we ever forced people to take any other vaccine? I mean, who cares if someone takes a vaccine or not? It's up to them. You know, if they want to take the risk, that's fine. But of course, what this thing has done, and I used to go on programs, you know, like Talk Radio, Talk TV, GB News and stuff. And so one of my worries is the way they've handled this COVID vaccine is going to put people off what at that time I called the normal vaccines. My view on that's changed slightly as well, I would say now. And I think for people to think more about what they take is nothing but a good thing. But interestingly, when we said 70% of NHS staff hadn't taken the COVID vaccine last autumn, actually the number that take the flu vaccine also dropped hugely as well. And again, there's not a lot of evidence that the flu vaccine does much good, quite honestly. The people that probably need it are the very elderly, and it doesn't work very well in the very elderly because their immune system doesn't react so well to vaccines and things.
Indeed. And just to go a little bit further on the findings of Senator Gerard Rennick over in Queensland, The discoveries were that the lipid nanoparticles had spread to all the vital organs.
Yeah.
The liver, heart, lungs, kidneys, brain, and testicles in men, ovaries in women. And it was promised, almost like a cast iron guarantee in the mainstream and from the government, that these vaccines were so-called safe and effective. But as it turns out, that wasn't the case. And as Andrew Bridgen has discovered by his access to the South African contract with one of the vaccine manufacturers, that the UK government had this 6 months in advance, Dr. Hinton, and they would have read the same contract, more or less,
Yeah.
but went ahead in any event and rolled out these trial medications.
Yeah. Well, we were told, weren't we? It stayed in your deltoid muscle and didn't go anywhere else. We know now that is completely untrue. We were told that very quickly the mRNA degraded, probably within a few weeks.
Yeah.
And then the spike protein was gone within a couple of months. Well, I've been doing blood tests on myself to see what happens with the spike protein. And of my 2 doses I took, the last dose was March 21. And the last blood test I had to look for spike protein antibodies was 2 years after that. And I'd still got hugely high levels of spike protein antibodies. Well, in my view, the only reason why I've still got huge levels of spike protein antibodies, or I did then, is because I've still got stuff making spike protein. And then I'm making an antibody response. I mean, luckily, as far as I can tell, I've had no ill effects. But of course, it also seems to be very batch independent, whether by design or by incompetence is difficult to know. But going back to the Pfizer data, of course, when you look back at the original Pfizer data and you follow up, for instance, just deaths that happened, up to a year after the trial, which they didn't count because they just put a cutoff date, more patients died in the vaccine group than in the placebo group. I mean, these things just weren't made clear. And you look now, you quite often see, don't you, cases reported in the paper from coroners, particularly of problems with the AstraZeneca vaccine. And you read the story and they're patients that were dying in early 2021. But of course, you're only hearing about it now because it's finally coming out with the coroner's report. And you think, well, if people had seen those reports in the paper in early 2021, far fewer people would have taken those vaccines. But that was all just hidden.
Well, many people quote the Nuremberg Code. They quote the Hippocratic Oath.
Yep.
And it seems, Dr. Robert Malone has touched on this, that within the medical profession, and this is his estimation, I'm a layman, I'm just repeating what he said, there seems to have been some mass psychosis combined with some sort of temporal inability to think straight where one's career was on the line. Cognitive dissonance is another term that psychiatrists and psychologists use. And it's come out from Matt Hancock. His diaries exposed by Elizabeth Oakenshaw, someone you know, that a group called the 77th Brigade were employed to bully and threaten these people and going against the Nuremberg Code, the Nuremberg outcome. This must have alarmed you and still alarm you to this day about what's going on in the West.
Well, I've tried to speak to other doctors throughout this period. And certainly initially, I'd left the NHS just before this all started. But anyone within the NHS that spoke out, they would have almost certainly have lost their job. And, that's difficult. If you've got a mortgage, if you've got
Children.
kids that you have to pay for and things. That's very difficult. I can understand completely why those people didn't speak out. I almost lost my job, but in the end, I remember when I was going for these two meetings at these two hospitals, saying to my wife, well, and I spoke to my wife and my secretary, because of course it was going to affect my secretary as well, because if I lost my job, she was going to lose her job. And I said, well, if push comes to the shove and they say, well, you're not allowed to speak out about anything, and if you do, you've got to go. I would have said, well, okay, that's it then. Bye-bye. I'll have to go. And we'll have to see you in court. But it didn't come to that, luckily. I mean, I've known these people for years. I will ask them at some point exactly what went on. I've got my own ideas what went on. But see, I speak to doctors about it now, and what they say to me is, why am I still going on about it? And I say, because we don't want it to happen again. Exactly. I said, if we don't get to the bottom of exactly what happened and why that happened. But yeah, so I think for a lot of doctors, they just wanted to keep their head down and didn't want to get involved or say. Quite a few doctors now do see my point of view, but certainly would still not talk out openly about it. And I think there's a lot of doctors that know in their heart that what was done was absolutely wrong, but and they were involved in some of it, and it's too painful for them to admit it to themselves. So they blank it out. I think it's a combination of those things. But
well, also, sorry to interrupt. It's been compartmentalized psychologically. They've moved on. It's too much to confront. But for time-wise, can I just get your views and thoughts on the World Health Organization, on the Pandemic Preparedness Treaty? That's what it's called this week, Dr. Hinton. It may change and morph into something else. But this is obviously a treaty where the World Health Organization will usurp and overtake our own health board and our own NHS, our own decision makers, our own government, to the tune of their beat, to the beat of their drum. Does this not absolutely shock you when you look at some of the characters that are involved, like Dr. Tedros himself? As a litany of allegations in his past. And I mean, what are your thoughts on the World Health Organization taking over sovereignty in the UK?
Well, of course, he's called doctor, but he's not a medical doctor at all. He's really a politician. Was at one point, I think, the defense minister. He was at one point the foreign minister. There were allegations of involvement in various army goings on, shall we say, in his own country. And of course, he was put in his current position at the behest of China. And of course, China is implicated. Well, not just China, of course, implicated in this whole thing. Various people in the United States were involved in that research that was going on in China. So it's still unclear whether it was, a lab leak or whatever. But either way, I think that's a bit irrelevant. The problem is the ridiculous response to it and the incorrect response to it. And of course, the WHO were absolutely instrumental in that incorrect response. All the way through, they made the wrong calls. Now, if we look at perhaps the Western country that has done better than any other, well, we have to look at Sweden, don't we?
Yes.
And we look at Sweden, they didn't close down schools, they didn't close down their economy. They stopped gatherings of more than 500 people. So large theatres and cinemas were closed. Some large sporting indoor events were closed. That was it. They didn't have mask mandates. They didn't have vaccine mandates. And I used to tweet about these things going on in Sweden. I've got a few contacts there. And people used to say to me, no, it's all locked down in Sweden. It's all locked down in Sweden. Well, I went to visit Sweden twice in the autumn of 2021 or 2020. I can't remember now, 2020. It's all a blur, isn't it? But anyway, one of those autumns, I went for 2 long weekends, one with my wife and one with my daughter. And it was absolutely fantastic. I wished I could have just stayed there. it was like normal.
Yeah.
It really was. And they've now got the best results in Europe for their economy, for their healthcare system, for their kids' mental health and their kids' education. And if it had been the case that they had to follow WHO guidelines that were dictated to the rest of the world, we would not have that example to look at. Now, you know, the reason why science and medicine progresses is often because different people take different approaches, and then you see what approach works.
Sure.
Very interesting that I think one of the people that tried to bring up Sweden in the UK COVID inquiry, I think was Professor Hennigan, who was, I mean, I watched that evidence session that he gave, and he was treated absolutely appallingly, not allowed to speak, spoken over. I think he got like 20 minutes when he was expecting to have about 4 hours worth of stuff to talk about. And that Hugo Keith just said, "Oh, no, we're not here to talk about Sweden." And that was it. Because, of course, it's too embarrassing. So this sort of one-size-fits-all approach by the World Health Organization, and then, of course, wanting to widen out, all of these non-governmental groups always want to extend their power, don't they? They're not elected. You can't get rid of them. Lots of elected politicians, of course, quite like that system, because when they get booted out as elected politicians, they've got somewhere else to go. That's why UK politicians like the EU so much, because they could go and do stuff there afterwards once they were no longer electable in the UK. But you've got to have people that take responsibility and are sort of, people are able to get rid of them. And with the World Health Organization, you can't. And of course, they now want to extend their remit to not just health as in viruses and bacteria and infections, but of course, climate change.
Yes. Well,
is
Patrick
a big
Vallance.
health issue.
Patrick Vallance is in the cabinet.
It could be lockdowns for climate change. You know, you could say, well, we can't have any cars in London this week because the temperature's going too high and it's causing to. I mean, who knows? I mean, these people just want more and more power, and the trouble is, it's power without any form of accountability.
Absolutely right. And during the COVID era, Keir Starmer was the opposition leader, the Labour Party. He wanted longer lockdowns. He wanted more draconian diktats on mandating that employees should be injected with these trial medications against their will if necessary. No jab, no job. All this was permeated out there. Now that he's Prime Minister, this is a double-edged question for you, Dr. Hinton, sir. What odds or what percentage do you think that we'll see another lockdown, and what do you think Keir Starmer's response would be to that lockdown?
Well, I think they'd be happy to try another lockdown at the drop of a hat. I don't think they'll succeed. I would say the last time they locked down, 98% of people probably complied.
Yeah.
I think if there was another attempted lockdown, I still think the majority would comply, but I think there would be a good 25, maybe 30% that would absolutely not. And that's too many people to arrest and put in prison. They wouldn't be able to do it.
And Keir Starmer's response?
Oh, he would want to go ahead with it.
Yeah.
Interestingly, some of my group have been sort of cozying up to some Labour MPs, their own constituency MP, before the election. And the message that we were trying to get across to them was, look, you know, here's all the real information about COVID and these vaccines and what's gone on. And assuming you get into power, which we're pretty sure they would, and they did, you've got a very short window to come clean and say, look, this is terrible what was done. We were fooled, just like the rest of you, because the government lied to us all. And if you have a proper inquiry and come clean about, this wasn't a virus that was going to kill off 10% of the population, and it didn't need a new vaguely tested vaccine that turned out to be dangerous and has harmed lots of people. You've got a short window to come forward and say, yeah, well, we've made honest mistakes because the government lied to the opposition just the same as they lied to the people. But they've obviously not taken that stance. They're just doubling down and still saying everything was done correctly. So they now have to take that responsibility for what's going on, with the vaccine injured and things. I mean, the vaccine injured are just being treated appallingly. They sort of get it from both sides, really, because some people say to them, oh, well, you're really stupid, you took the vaccine. And then other people say, no, what you want about, this vaccine saved millions of people. Yeah. So, I mean, and of course, they're called anti-vax. Well,
yes. Oh, yes. All the
they took the
smears.
blooming thing.
I mean, we were called granny killers. Now, I've not taken the vaccine. I actually spoke to my doctor about it. I had an adverse reaction from a vaccine that I had to take in a trip to China.
Yes.
And I had coagulation in my leg. One of the veins failed in my leg. So I went to the doctor, took a deep breath, and he said, I can't tell you what to do, but I would definitely have a serious think about it. And that was his way of saying, stay away.
I think, I think that's probably as far as your own GP would go. But that was a message.
That's right. That's right. And that was enough for me to say, plus I read what the BBC said, and they said to take it. So I went the other way. I thought, that's
always a good go, I think. Yeah,
that's quite a safe bet. But looking at, in a positive note, in the last 5 minutes or so, for those people that are watching that maybe have taken the vaccine, even for the people that haven't, what we didn't hear was how we can boost our immune systems, just as concepts and themes. I'm a lay person. And we can talk about concepts and themes of things like vitamin D, your diet, exercise. What are the kind of themes, if I can put it to you, that people could possibly look at if they chose to?
Yeah. Well, there is good news.
Yes.
I was on a call with some virologists about a month ago. And on that call, there are lots of doctors and scientists. Most had not taken the vaccine. Some, like me, had, reluctantly. And there's always a question comes up about, well, my vaccine, that was years ago. How long do I have to worry that vaccine is going to cause me some harm? And the answer was interesting because for quite a few years now, there have been genetic injections used in medicine. So, for instance, for things like cystic fibrosis, where you have a bit of a gene that's not working properly, and that affects the proteins that are made in your lungs, and you get lots of lung problems, and those people get multiple infections and die at a younger age than they should do otherwise. And you can inject the correct bit of the gene using viruses and other methods into those patients, and they get a lot better. But actually, the virologist said the good news from the point of view of the people that have taken a COVID vaccine, which is a similar sort of technology, if you like, it's some sort of gene-based thing that you're putting in, is that those treatments for cystic fibrosis seem to just wear off after about 3 years. And there may be two mechanisms. It's either that your body starts to recognize that new bit of genetic material as foreign, and it basically gets rid of it using our own fantastic immune systems, or somehow that newly injected gene just gets neutralized and turned off. And they were of the view that basically the same sort of thing will happen with this COVID genetic material, that perhaps around about the 3-year mark, it will get turned off or it will be got rid of. And probably another 6 months or so, I'll do another one of my little blood tests and see if I'm still producing spike protein antibodies, which would be nice to see that no longer the case. So I think there is good news in the future. For people that are vaccine injured, I would say there are a lot of doctors around that will see patients with that now. You can find them on the internet. And if you go to various, there's a lot of American websites that do that, but also they'll have links into people in the UK that deal with vaccine injuries as well. And there are things like nattokinase, which comes from, I think it's fermented Japanese soya beans. And the nattokinase enzyme is supposed to degrade spike protein. People have tried ivermectin as a treatment for continued spike protein production. And indeed, I tried that for about 4 weeks and then did another blood test to check my spike protein antibodies. Didn't make any difference. But I don't particularly have any symptoms anyway. If we're looking at more general, how can you boost your immune system sort of naturally? Well, I would say fresh air, sunshine, exercise, eating proper food, not lots of processed food.
Yeah.
You can add in things like vitamin D. With vitamin D, you should also take vitamin K2, because one of the things vitamin D does is you absorb a bit more calcium. But you don't want that calcium just flowing around in your blood, because you can get like kidney stones and stuff.
Sure.
So what the vitamin K2 does is it pushes that calcium into your bones. So particularly ladies get a bit older, that's also good for things like osteoporosis. There are lots of foods and natural vitamins that are good for health in general. So I take vitamin D, vitamin K2, I take vitamin C. And then recently, this is slightly off topic, but recently there were these discussions about these new wonder drugs for Alzheimer's.
Yes.
Now, the wonder drug for Alzheimer's, you've got to only give it to patients with the very, very earliest symptoms. So for most people, it's not any good anyway. It has to be given by an infusion, so a gradual injection and a drip every 2 weeks. Every time you have it, there's about a 1 in 1,000 chance of having a brain bleed. That's the risk. And it reduces your dementia progression by only about 20%. And in fact, in tests that they found it was actually measurable on the normal standard tests. Now, you can take omega-3 fish oils and vitamin B12, and that reduces the progression of your dementia by 75%. And the difference between the two is the pharmaceutical one costs £10,000 a year, plus another £10,000 in actually giving it to patients. And the omega-3 fish oils and the vitamin B12 costs pence.
Yeah.
So there's no money in it. So those are the things that I take. And, try not to be too overweight, lose a few pounds if you can. Those are things. I mean, I wouldn't particularly advise people to take flu shots or anything. I don't, but particularly some of the new ones coming out are going to increasingly change to this same.
Sorry, Dr. Hinton, is the efficacy of these flu vaccines not around 7%?
Well, for the efficacy gets lower and lower the older you are. And it's the elderly people that are most at risk of flu. My parents always used to take the flu shot, and we always used to joke to them that they were always ill for 2 weeks afterwards.
Yeah.
My dad's 91 and he doesn't take it anymore.
Well,
my dad actually rang me. His GP was pestering him about he'd had his 3 COVID shots, and he was getting pestered. He was very early on because of his age, and he's been pestered about a 4th. And he rang me and he said, Anthony, I'm not sure what to do. I'm not sure what to do. And he said, how is a 4th going to work if the 3rd one hasn't worked? I said, Dad, I think you're onto something. And he didn't take any more. But he could potentially now be on number 8. It's mad.
Listen, Dr. Hinton, it's unbelievable. All the playbook that we had for maybe a century before was thrown out the window. The World Health Organization was listened to. The propaganda coming out
Yep,
from China that we now know is it's absolute lies. The people dropping dead in the street, morgues in New
absolutely.
York. These were morgues that were
Yeah,
being used anyway. Bodies being stacked up were
yep.
prisoners or homeless people. God bless them. But all that information is out there, and we recommend that everybody and anybody watching this interview get into your Twitter page, and all the works and information that you do, we'll always repost them. But all it really remains for me to do, sir, is to thank you so much for coming on to Herd Immunity News. We could talk about this topic infinitum.
You could.
There's so much to cover on this about the people who
Yeah.
have been vaccine injured. But I think as a nice platform for a first interview, maybe we'll get in touch with you before the 6 month period when you do that.
Yes, yes. No, I'll be very happy to chat to you again. Yeah.
You do that for the
It's certainly not over, that's for sure.
No, that's the thing. We're still living. We're still living in many countries. We've got followers from Australia that are still testing before going into
Yeah, yeah,
nursing
absolutely.
homes.
And Canada is mad.
Yeah.
I mean, I have doctor colleagues in Canada that have been absolutely persecuted, but I've got doctor colleagues here that have been persecuted and coming up in front of the GMC in October for basically speaking the truth, really. That's all. But Canada and the United States, you can still get jabs down to 6 months old and still being recommended. Canada, they were giving out free ice creams to kids to get jabs and said they didn't need their parents' permission. I mean, Canada just went absolutely loopy. And a lot depends which politicians are in charge.
Well, there was also the case in New Zealand when Jacinda Ardern was in there. A couple who didn't want their baby, who had haemophilia. It was a little haemophiliac baby. They didn't want him to have blood from someone who had been vaccinated, and they actually took the
Yeah,
child away from him and
yeah,
took it into custody, and it was taken away from their parents against their will. Now, heaven forbid anything happened to that small child moving forward, but
yeah.
you must just think about these things and shake your head, sir.
You see, well, I mean, vaccination, I think, very difficult. I mean, I can absolutely understand why somebody that has not had that vaccine
Mm,
would not want a blood transfusion from somebody that has. I don't know that the science would show that that is a risk.
mm,
I don't think anybody knows is the answer. There's so much of it at the moment that
right.
still people don't know.
But in that case,
Um,
wouldn't you be wiser to eliminate that possibility and take the
you would,
plasma?
but apart from, well, no, the sort of the plasma is no different than a blood transfusion. That would still have the same risks if there are risks. The only way to deal with that would be to have a relative that you knew
Mm,
that was as close, that was a close enough match to your blood groups,
mm,
and blood groups are very, very complicated. That would be the only way to do it. Or sometimes, for instance, patients that are undergoing surgery. So if you've got, say, a Jehovah's Witness that's undergoing surgery, you may be able to get them to donate their own blood
mm,
a few weeks before.
sure.
You can then keep that blood cold and it'll last for maybe about a month or something.
Mm,
And their own body then makes up that blood that you've taken. So by the time they have an operation, there is a small amount of their own extra blood that can be used. So use the patient's own blood. I mean, that would be the only definite ways
yeah.
to make
There
sure
are
that.
even
Okay.
websites now. There are women looking for men who haven't been jabbed to start families
Yes.
with.
Yeah, yeah, yeah.
So God knows how
Yeah.
they actually prove, how they would take a sperm sample or a blood sample and prove. I guess could you test for something like that to see whether or something had the
Well,
jab?
you can test whether somebody's had the jab,
Mm-hmm.
because if you've had the just the vaccine,
Yeah.
you'll get antibodies specific to both the vaccine and the infection. You get the same antibodies from each.
Mm-hmm.
But then he can also do a specific test for the infection, and that gives a different sort of antibody. Yeah.
Yes.
So if you've got somebody that only has the antibodies from COVID infection and not the other antibodies, you know they haven't had the jab. So you can tell if someone's had the jab or not.
Well, this was the point made by Novak Djokovic, the tennis star. He said, "I'm immunized." When
Absolutely.
he was,
Well,
yeah,
they told us as well, you couldn't get immunity by catching it. And I thought, well, I mean, I just thought that's the first infectious disease that I've known that you can't get any immunity from catching the disease. This is just like complete anti-science.
Yeah, well, that's why we believe in herd immunity, learned immunity, acquired immunity, natural immunity. And it's great people like yourself that set us and probably millions around the world off on a path to say we're not crazy. Even though we're lay people, we are not mad. And to a lot of people, there were alarm bells ringing. And in these instances, you don't go left, you don't go right, you do nothing.
Yeah.
But anyway, sir, thank you very much for appearing on Herd Immunity News. We will leave the links to your Twitter page. Do you have a website or anywhere or anything else in that regard?
Oh, only for patients.
Okay.
And it's better I keep the two things separate.
Indeed. Indeed. Well, thank you very much. We will be posting this out very, very shortly, and we would love to have you back on later on.
Good to chat.
Towards the end of the year, but you've been absolutely fantastic and very generous with your time.
Thanks,
Dr.
Mark.
Anthony Hinton, thank you very much for appearing on Herd Immunity News, sir.
Pleasure. Thank you. Bye-bye now.